Hi, I'm Thorben and we're here at the Festival of Genomics in the heart of London with a very special guest, Parker.
Thorben, it's great to be with you as always. So my name is Parker Moss. I'm the Chief Partnership Officer at Genomics England. I also lead all of our research technologies, and I'm one of the guys that leads the cancer program as well. So Genomics England was the British company which is wholly owned by the Department of Health, which was set up to lead the 100,000 Genome Project. So this was a huge disease cohort of cancer and rare disease patients that recruited over 100,000 people between the years of 2012 and 2019. And we became well known for that. It was the first large-scale whole genome sequencing program to be done at a national scale anywhere in the world.
Absolute pioneering. You've done a lot of work in COVID as well during that time, but what are some of the strategic programs that you're focusing on now as GEL?
That's right. So after we finished the 100,000 Genome Project, we sequenced 35,000 patients with COVID, 20,000 who were acutely ill, not just in hospital, but actually were either on mechanical ventilation or on ECMO. So we've moved on a lot from that since, and we've got some really, really exciting programs, which we're doing very importantly in partnership with the NHS. So the first activity we do, and our key priority, is on the healthcare side, where we are whole genome sequencing for diagnostic purposes cancer and rare disease patients in the NHS today. And patients today are already benefiting from the deeper clinical insights that we can extract from the whole genome. So that's our clinical program, but we are, as you know, an exciting research program as well. So we were recently funded, after years and years of public dialogue and ethics, to sequence 200,000 newborn babies. And we're kicking off the first part of that program, which is 100,000, and we're going to be starting to sequence 100,000 newborn babies this year. Now, this is a research program to prove both the clinical utility and also the health economic value of that. If that works, we hope to progress to be the first country in the world to whole genome sequence all newborn babies, of course with the consent of the parents.
That's phenomenal. On the research side, what are some of your immediate focuses there?
Yeah, so we're doing a lot of other really cool things in research. We are finally going beyond the whole genome, and initially in rare disease, but we hope soon in cancer as well. We're exploring both the transcriptomics and the proteomics of disease, so that we can see not just the DNA foundation, but how that transcribes into RNA and then translates into proteins, which you can of course drug.
And where are some of the challenges that are lying ahead on that road? Scale obviously being one, but what are some of the challenges that come to mind?
Well, Thorben, you're helping us with some of the challenges, and Lifebit is really one of our very major partners. So the challenge as we increasingly molecularly stratify disease is that all diseases essentially become rare disease. So even common cancers like breast cancer, for example, now have tens and tens of subtypes. And that means a few things. One, it means we need a lot of eyes on those cancers. So we need to make sure that we can attract researchers from both the commercial, biopharma sector, but also from academia and from all around the world to study our data. And secondly, we need to federate that data with other similar genotype cohorts around the world so that we can get to sufficient power in these subgroups to actually study, to power GWAS studies, to build powered mutational signatures, etc. And the great thing is that now some of the technological tools are in place to do that. So all of our data sits in Amazon Web Service, which is a very important infrastructural foundation, but Lifebit are providing the front door and the user experience, the tooling, the billing platform, and also the federation capability so that researchers can have an immersive experience and work with our biobank peers around the world.
Thank you so much. Thanks for coming here, and thanks for the great work we've been doing together for so many years.
Good to be here, Thorben.